I want to talk to you about a disturbing trend that I've noticed lately. In terms of the portrayal of the education of practical nurses in the press and in our workplaces. Practical nursing education is a college-level diploma, and we're talking 5 semesters in terms of most schools, 5 semesters, 2.5 years of very rigorous education. In terms of how it's being portrayed in the press, it's being portrayed as if it is tantamount to being nothing, worthless, doesn't make you a nurse, isn't quality. And I don't understand why every person who has a college-level education isn't up in arms over the way they're being portrayed. First of all, the practical nursing education in Ontario all takes place in accredited programs in excellent schools, like the one I'm in today, Georgian College, or Humber, or Confederation, or any of those 24 great programs at great schools in Ontario. Fully accredited. That means they have to reach a certain bar of quality before the students can enter the program. And the program itself is more difficult and rigorous than it has ever been. In order to practice in Ontario, the graduates of the programs have to pass a provincial exam. And it's not an easy exam. I teach a little bit at Humber College, and I'm amazed every day when I see, first of all, the expectations in the curriculum, but also the caliber of students and the caliber of work that those students are handing in to me. This is not a group of people who know nothing. And yet when we read the press, we hear it referred to as just a college diploma. It is really portraying practical nurses as having an education that amounts to very little. Within the environments that practical nurses work and provide care, they are capable of providing the highest excellence of care to the patients who have less complexities, although they certainly can have a level of complexity, and more predictable outcomes. Doesn't mean they have to be entirely predictable, but the very, very unpredictable patients, the patients that you don't know what they're going to look like in half an hour. Those are more suited to the RN level of education. The practical nurses, though, are educated to autonomously provide excellent care to the group of people that they're assigned to. There are really progressive schools, like the one I'm standing in right now, who is working very hard to find parts of their programs where RPNs and RNs should be educated together. Because there's such a shared knowledge and an overlap, that it makes sense to have them in a room together to learn how to interact with each other in the workplace. And I have a deep appreciation for schools that are doing that. And yet, in spite of all of that, we see the word just in front of college education, as if it is something to be embarrassed of or something to be replaced later with a great deal of quality education. I can tell you that I've returned to school many times, and I can tell you that each time I go back to school, it is not to replace an inferior education that I received before, but rather to build on it. The skills that I received in my college diploma are still of great value to me and something that I use every day, as does every nurse that starts her education with a college diploma. So I guess our message for you today is that we hope everyone recognizes that the education received, regardless of the institution it's received from, or regardless of the level of education, prepares you for excellence within a role. And no one category of nurse is more important than another, and nobody in the healthcare system in terms of people who work in the environments where people heal is more important than one another. And we want to call on everyone to start respecting everybody that works in the workplace, to work together to build a team of healthcare providers that is effective in the most challenging times I think we've ever faced in healthcare, and that way we can make sure our patients, clients, and residents receive the very best care from the very best people.